What's up, guys? All right, so look, I wanted to shoot a video to talk about what are the risk factors for pain pill addiction. Now, technically, the term is opioid use disorder, which is basically where there's a pattern of opiate use that causes some type of impairment or harm. Okay, and within that, yes, we have addiction. But there's a difference between things like addiction, dependence, tolerance, and all that. But all those things can be, involved. But today I just mainly want to talk about your risk factors for having problems. And the first risk factor, which you have no control over, is your age. So if you're under 45, you have a higher risk, I guess, than somebody who's over 45, but that does not mean that someone over 45 cannot struggle with opiate use disorder, okay? Another risk factor is, and this is the one that is the most obvious, do you have a prior history of drug abuse or addiction? Now, this can include prescription drugs, illegal drugs, or alcohol. And then the next risk factor is family history. Do you have a family history of somebody who has struggled with either prescription drug abuse, illegal drug abuse, or alcohol abuse? And most of my patients that I treat for addiction have a first-degree relative that has also struggled with addiction. And we'll kind of discuss why that is the case in a little bit. The next risk factor, and I think you can understand why, but it's if you were sexually abused at a young age, that puts you at a high risk for opioid use disorder. Now, let's talk a little bit about just the addiction itself. Why? Well, what's the problem? I mean, everybody knows we have a huge issue with opiate addiction in America, across the world. And it's almost, and it didn't really sneak up on us, right? But there were things we just didn't quite understand, because usually in our heads, right, with addiction, we think of, you kind of start out young, you start out with gateway drugs, you're experimental, and one thing leads to another, and your just use escalates over time. But all of a sudden we found ourselves with many people getting prescriptions from doctors and finding themselves addicted, or not able to stop their medications because they've developed such strong dependence that they have severe withdrawal, or they find themselves escalating their use because of tolerance. They're self-medicating. Maybe they actually do have chronic pain issues, but their pain was never adequately controlled, so they kind of took more medication, and they found themselves in a bad spot. Now, one of the things you have to understand is that that the dopamine pathways in your brain are affected when you take an opiate. And some people have a higher dopamine response than others. So let's say two people break their leg and they're prescribed pain medication. One person might just basically, have good pain relief, whereas the other person might have good pain relief but also have this sense of euphoria. But it doesn't necessarily mean you feel like you're getting high. It may just mean that you have a lot of energy. You felt I could actually go to work today. This is the first day I felt like I could go do something. I could clean the house, etc. You just felt energized. And that is a sign that you have an abnormal dopamine response. And a huge problem comes to play when you take the medication for energy and not for its intended use, which was to help the pain. Okay? And so if you take this medication, if you're prescribed a pain medication, take it as prescribed. If you find that you're taking it because it gives you energy or just some kind of boost or just some kind of increased, feeling just good, maybe it makes you less depressed, then that's actually not a good thing, and you need to talk to your doctor as soon as possible about that, okay? And that just reminded me, because I left one of the risk factors out. One of the risk factors for opiate use disorder is another mental health disorder, such as depression, ADHD, bipolar disorder. So if you struggle with any of those, then you really need to think twice before taking an opiate for pain control. Now, obviously, sometimes we're in situations you can't control that. You know what I mean? If you get in a car wreck or you have to have a major surgery. But the idea is to know your risk factors, understand what's going on with your body, and only take the medication as prescribed. And be very upfront and honest with your doctor at all times, okay? I think this can help. A lot of this information you probably already knew, guys, but I just wanted to share it with you. And if you have any questions or comments, leave them below. All right, guys, that's it for today. Reject apathy, fight nihilism, love your neighbor. Peace.